I now invite CEO of our Basavatarakam Indo-American Cancer Hospital, Dr. K. Krishnaya garu, to deliver from the welcome address.
Good evening. Respected and beloved Chairman Shri Nandamuri Balakrishna garu, today's chief guest, highly respected Shri Dr. Srinath Reddy garu, Dr. Prasad garu, and our dear, very close associate and great well-wisher of this institute, Shri Prasad garu, President of the Indo-American Cancer Foundation, Shri Dr. Mohan Rao garu, my friend Dr. T.S. Rao garu, dear doctors, nurses, media persons, ladies and gentlemen, a warm welcome to Basavatarakam Indo-American Cancer Foundation and Basavatarakam Indo-American Cancer Hospital and Research Institute. Indeed, it's my great pleasure and honor to welcome you this evening. Basavatarakam Indo-American Cancer Hospital was started by a great visionary, Vishwavikhyata Nata Sarvabhauma, Shri Nandamuri Balakrishna, with a great vision in mind, started this a long time ago and started functioning from 22nd June 2000. So incidentally, this year, this great institute is celebrating 25 years of successful completion of service for the cancer-ridden patients. Started with a very modest 100-bedded hospital with a great vision of serving very poor. Those days, there wasn't a great deal of treatment available for cancer patients, in particular poor patients. Now, it has reached 650-bedded state with 300,000, 3 lakh patients every year coming to our outpatient department, and 90,000 patients are being admitted every year here, with 8,500 surgeries done every year, and also a great presentation of pediatric children cases as young as 1 year old being treated here. And with that, this institute stands very tall in the cancer treatment hospitals in this country. Research is an extremely important part of cancer. It's an integral part indeed, with huge volumes that are available in here, and the research attached will make a great deal of difference. And today indeed, a milestone in this long journey of this hospital, that we have this upgraded and state-of-the-art cancer research facility just being inaugurated by the chief guest. I'm so proud to say that we are set for this mission to go into the new world, innovate procedures and methods that will be available to the people in this country. At this time, most of our protocols, most of our treatment regimes are imported. They are designed elsewhere in the developed nations, and we learn all those and try to practice in here. That's where the big controversy is. That's what makes treatments are very expensive. If cancer destroys the patient, cancer treatment destroys families. That is a tremendous burden, and in this hospital, of course, we do not refuse any patients and try to treat every case with the best possible way and with the least possible cost. Now there is this burden on us, responsibility, if you like, or obligation to the society to find new innovative methods, understand all that advanced knowledge and localize it, homegrown kind of procedures we should develop. It's just beginning to happen. Unfortunately, so far still we are nowhere near what is expected. If you look at in 2020,
new innovative methods,
7.2
understand
lakh
all that advanced
applications
knowledge
came from China,
and localize it,
not the United
homegrown
United
kind of
States.
procedures we should
Became
develop.
number 2.
It just
And
beginning
although
to
we have
happen.
done very well, still
Unfortunately,
with
so far
1.2
still
lakh
we are nowhere near
applications,
what
still
is
nowhere
expected.
near.
If you look at in
This is where
2020 new innovative methods,
7.2
understand all that advanced knowledge from China and localize it, and homegrown kind of procedures we should develop. It just
We know
beginning to
well
happen.
that
Unfortunately,
manufacturing
some find still
mass
we are nowhere near this
costing only 450
If you
crores.
look at in
This is
2020
much less than
new innovative methods, understand all that advanced knowledge from China and localize it, and homegrown kind of
40 years ago, you get a treatment for HIV and AIDS used to cost $10,000 to $15,000 per year. Now in India, Galaxy, Reddy's Lab, etc. developed $100,000 billion. I'm sure it is very helpful. Very important. That's what we need treatment for HIV. So we need research. We need homegrown Otherwise, if this trend continues, we see every day families selling all their money belongings. It's such an emotional issue for their children to pay for the treatment. And it's so expensive. Even crores to be developed, especially when it comes to children. So there is a huge responsibility on us to make that happen. And I strongly believe that we are doing something right ahead of the China for their children. And I'm sure what has happened today, I can see 5 years, 10 years from now, see that we contribute. We tell the whole world, in particular the developing nations, this is how cancer should be treated with a fraction of a cost. I can visualize that's going to happen with all what has happened today. I must mention a special mention to a great person, Dr. Raghavendra Prasad, who came along us and handheld us
very modest
to
100-bedded hospital with a great
pat on
vision
the back and helped us for this
Those
to
days,
happen.
there was
I
a
have
great deal of
my
treatment
special
available for cancer
thanks
patients,
and
in particular poor patients.
my appreciation for his
Now,
great vision.
It
Thank
has
you very
reached
much.
650 bedded state with 300,000
Thank you,
3
sir,
lakh
for the
patients
warm
every year.
Next
coming
up,
to
I
our
invite our
outpatient
medical director,
department.
Dr. T.
And
Subramanian.
90,000 patients are being admitted every year here with 8,500 surgeries done every year. Also, a great presentation of pediatric children cases as young as 1 year old being treated here. And with that, this institute stands very tall in the cancer treatment hospitals in this country.
Grown up, hearing about your work, your exploits.
Research
Real privilege.
is an extremely important part of cancer.
The energy source of
It's
this
an
hospital.
integral part indeed, with huge volumes that are available here
Our chairman.
and research attached will make a great deal of difference.
Mohan Rao Garu,
Today indeed,
somebody who has been
milestone
trying very hard
in the
to
this
get the
long journey of
research on
hospital
the track.
that we have this
and
updated
his
and state of the art
persistence
cancer
seems to be paying off.
research facility
It
just being inaugurated by the chief trustee.
People
I'm
have
so
done-
proud to say that
this is
we are set for this mission to go into the new world, innovate procedures and methods that will be available to the people in this country. At this time, most of our protocols, most of our treatment regimes are imported.
What happens is when
They are designed elsewhere in the developed
want to do
nations,
something really
and we learn all those and try to practice it here.
And that has happened through the family of
That's where the big controversies. That's what makes treatments are very expensive.
Silver Prasad Garu,
If cancer destroys the patient,
real active.
cancer treatment
Agile,
destroys families.
transport member and treasurer.
That is a
He's
tremendous
there,
burden.
either in-
And in this hospital, of course, we do not refuse any patients, and
really
try to
appreciate his efforts.
treat every case in the best possible way and in the least
He's
possible
there.
cost. Now there is this burden on us,
Very special.
responsibility, if you like,
Action of the CEOs.
or obligation to society to find
Yes,
new
public-
innovative methods, understand all that advanced knowledge and the local
We've been
and
talking about it from
homegrown
day one, that
kind of
research is
procedures we should do.
more important.
It's just beginning to happen. Unfortunately, so far still we are nowhere near what is expected. If you look at in 22 new innovative methods, understand all the advanced knowledge from China, the localizing, homegrown kind of procedures, we should get number 2. It just beginning to happen, very well still it's qualified still, we are nowhere near this particular. If you look at it, this is where new innovative methods, understand all the advanced knowledge from China, the localizing, homegrown kind of procedures, we should get number 2. It just beginning to happen, very well still it's qualified still, we are nowhere near this particular. If you look at it, this is where new innovative methods, understand all the advanced knowledge from China, the localizing, homegrown kind of And I'm sure what has happened today, I can see 5 years, 10 years from now, see that we contribute. We tell the whole world, in particular the developing nations, this is how cancer should be treated with a fraction of the cost. I can visualize what's going to happen with all what has happened
That's
today.
I think ultimately
I must mention a special mention to a great person, Dr. Rajendra Prasad. He came along us and handheld us very modest to the great of the bank and helped us for this to happen. Very ideal, my special thanks and my appreciation for this great patient. Thank you very much. 600 people, 300,000. 300 patients every year.
Next time, I invite our medical director, Dr. T.
And 90,000 patients are being admitted every year.
Inviting Dr. Ravindra S.
8,500.
Please put your hands
Surgeries
together.
done every year.
Dr. Ravindra S. Prasad garu and Srinath Reddy Prasad garu for their exemplary
Children
contributions
cases as young as 1 year being treated
In their
here.
honor,
With
the
that,
name of this
this
facility
stands
as
very tall in the
Kalyani Prasad Basavatarakam Indo-American Cancer Research Center. Sir, your generosity reflects the spirit of philanthropy that has always been the cornerstone of your business. Thank you once again.
It's particularly important need with huge volumes that are available here and research attached will make a great deal of difference. Today indeed, milestone in this long journey that we have this and state-of-the-art cancer research facility just being inaugurated by the Chief Justice. I'm so proud to say that we are set for this mission to go into the new world, innovate procedures and methods that will be available to the people in this country. At this time, most of our protocols, most of our treatment regimes are imported.
What I can see is when
They are designed elsewhere in the developed nations, and we learn all those and try to practice them.
promote in our institution as much.
family of.
That's where the big controversy is. That's what makes treatments are very expensive.
Sir garu,
If cancer destroys the patient,
real active.
cancer treatment destroys families. That is a tremendous burden. And in this hospital, of course, we do not refuse any patients and try to treat every case in the best possible way at the least possible cost. Now there is this burden on us, responsibility, if you like,
Of the CEOs.
or obligation in society to find new innovative methods, understand all and advanced knowledge in the local
We're
and
talking about it from
homegrown
day one.
kind of procedures we should do.
More important.
It's just beginning to happen. Unfortunately, so far still we are nowhere near what is expected. If you look at it, 20 new innovative methods, understand all and advanced knowledge from China, the localizing, homegrown kind of procedures, we should get number 2. It's just beginning to happen. Very fast, so far still we are nowhere near this actually. If you look at it, this is where we need new innovative methods and understand all and advanced knowledge from China, the localizing, homegrown kind of procedures, we should get number 2. It's just beginning to happen. Very fast, so far still we are nowhere near this actually. If you look at it, this is where we need new innovative methods and understand all and advanced knowledge from China, the localizing, homegrown kind of procedures, we should get number 2. It's just beginning to happen.
Good evening to everybody and Srinath Reddy garu is inaugurate our teaching center and it was our beloved chairman Padma Awardee Shri Nandamuri Balakrishna and our teaching center President Sri Nandamuri and those members Sri Nandamuri all the respected dignitaries in front of us and very nice day for us. I think really wonderful. I want to, because already Professor told my CEO and Mr. Director told, it's a worldwide India medical cancer treatment.
What is happening today, I can see 5 years, 10 years from now, see that we can do.
2 days back,
We tell the whole world, in particular developing nations, this is how cancer should be treated.
the success rate of the
I
country.
can visualize what's going to happen with all what has happened
We are
today.
very proud.
I must mention,
Reaches.
especially
We are
mention
very
a great person, Dr.
proud.
Prasad, who came along
I
us.
think this should, we have created this research center for 2 years. We made the progress what we anticipated because of so many conditions. Fortunately, today, with the support of Dr. Basavatarakam who created a wonderful facility. Sir, once again, thank you to, like I said, when we started this issue, so many donors has come to support this hospital. Today, the hospital has reached to the stage because of the lot of volunteers donated and supported. And that got the wonderful support the we can start. We promise every place and we show the success to the world. This institute is capable to do the thing. That is our endurance. And one more thing I think this auspicious day, we have to remember our great philosopher, next Dr. A.T. Ramarao garu to create the institute. For this research institute to run it, Dr. Kakarla Sumarao garu to remember. He is the person who always said to us, we have to create R&D, we have to do something, we have to do things, we have to be good at treatment. But how to do it all things? I think fortunately he's not here, but he may be the output. He can watch us the achievement. I think we all, and the doctors and everybody, team of Basavatarakam, who can do, make it this our research center also, to make it to the top. India's research center, I think, what to bring, that is the commitment. all of us who can do the thing, then people will believe us what we do and all the things. Once again, I'm so thanking everybody giving me opportunity to possible this thing. Once again, thank you.
Thank you, Mr. Now, next, I invite Dr. C.S. Nandamuri, President of Indo-American Cancer.
Treatments are very expensive. If cancer destroys the patient, cancer treatment destroys families.
Lineup of
That is a
personalities
tremendous burden.
on the dais. Everybody is a star of our country.
We do not refuse any patient. And
My friends,
trying to
in the audience,
I
it is the honor to stand before you on this today momentous occasion
Now there is
of
this word
inaugurating
among
this
us.
center.
If you like,
This center, I believe, should stand as a beacon of hope, innovation, and determination
innovative methods, understand all and
against
advance
cancer.
knowledge.
When we talk about cancer, also
Kind of
about
procedures we should
which are
follow.
important.
It just beginning to happen. Unfortunately, some
Any cancer, anybody
we
can
are not
relate
here
with
what is
that.
expected.
And it really causes problem in families having conquering this disease, very global challenge. Not only cancer, solving any disease, any medical problem, would have two components. One is to understand the disease. What is the disease? That is biology, that is science. What is it? Understand it. What is going wrong and how we can correct. That is one part of the story. Once we understand that, then it comes to delivery of the patients, identifying who can be benefited with this approach and deliver it and take care of all the consequences in the medical community. Both of them are very critically important. For example, recently we all suffered with the corona. When corona came in, when people were started dying in China, first of all people should know why are they dying, what is that causing them. So first you have to identify what is that virus that is causing, and then what is genome, what's the DNA, what's the RNA of the DNA of the virus, and what proteins are there, which spike protein everybody now knows, spike protein, and make an antibody out of that. All that is a science job. Create a vaccine. Once that is done, take care of patients, and also of course even before symptomatic treatment all to be provided by the medical doctors. So whenever we are talking about solving a health problem, there are two components. One is research, one is medical delivery component. So research is as important, if not more important. Now we all talk about MD Anderson, Mayo Clinic and things like that. Why do we talk about these institutions compared to the rest of the institutions in the world? Because these are all cutting edge research scholars. They are doing cutting edge research, and because of their research and their delivery, they are very, very famous and they're very, very important. That's very important for all of us. So our vision of this center, I believe, would be to integrate clinical and scientific expertise that we have to go from bench to bed and bed to bench. That is what we will be trying to do for treating cancer. We are planning two-pronged approach, as mentioned before. Two-pronged approach is, first of all, is that there are many treatments available in the world for cancer. These treatments are very expensive, so expensive that many people cannot afford. For example, CAR T cell treatment is available in US, in the rest of the world. CAR T cell treatment is, if you import everything from outside the country and treat, it may cost 3 to 4 crore rupees per patient. That's impossible to, for many people, most of the people. But now in India, people are developing CAR T cell technology. Now we can probably do it for will identify what gene is responsible for a particular problem and try and treat that. So we can, our center here can look for all the precision medicine knowledge available, all the genes, and when a patient comes, we can use our techniques available to identify which will be appropriate treatment for the person. So we can provide such technical scientific capabilities for the clinicians so that they will be able to treat patients very well. This is on one arm of the center, new center that we are talking about. This is one arm. Other arm, which is most important arm, is to carry out basic research, to understand the process of the disease, how the disease develops and what genes are involved, what proteins are involved, and how we can stop the disease. This is the basic part of it. And here we also need to have very less expensive, faster diagnostic tools. Early diagnosis is the most important. If you diagnose early, cure possibilities are very, very high, particularly in cancer. So we need to develop certain amount of new technologies, which are nowadays technology become very cheaper and easier. So we can use a lot of molecular tools to develop diagnostic methods, and these diagnostic methods should be very useful. And then we can develop those things in the center. So as I mentioned, we have two aspects. One is bring the external knowledge that is already available to our people, and second is do research so that it will be globally beneficial for everybody. So that's what I think will happen. Develop newer, faster, cost-effective methods for early diagnosis and join hands with the global community to fight against the cancer. I think the work will go on very well at the center, and as we mentioned, the donation that is made will be certainly well utilized and people will get benefited. The researchers and doctors of this hospital and many scientists and younger people will dedicate, I believe they dedicate their time and efforts to this cause. And any institution is only as good as the people it has. It's the people that counts. Building and other things are secondary. Right now, we are still looking for good people to lead this center. So we need good people. Unless we have a very large number of good committed scientists, we will not be able to succeed. So we need first good people. Now today we are not just inaugurating the building, but we are inaugurating a hope, resilience and progress. We are setting a stage for a journey that will save lives, alleviate suffering and inspire generations to come. Thank you.
Thank you, Montana sir, for inspirational messages. With the great honor, I invite our respected, dynamic, young, not by age but by thoughts, spirit, and shaping the Cancer Institute like this, our chairman, Padma Bhushan awardee, Shri Nandamuri Balakrishna garu, to address us.
అందరికీ నమస్కారం. ముందుగా అందరికీ తెలుగు నూతన సంవత్సర వసునామ సంవత్సర ఉగాది శుభాకాంక్షలు తెలియజేసుకుంటున్నాను. ఉగాదితో ఈ యొక్క కొత్త ఇక్కడ మన ఆసుపత్రులు కూడా ఈ యొక్క ఆసుపత్రి యొక్క ఎవరైతే ఈ ఆసుపత్రిని ఒకళ్ళ కళను సఫలం చేయడానికి ఉద్దేశంతో ఈ ఆసుపత్రిని స్థాపించబడిందో వారి అన్ని విషయాలు కూడా అటు ఆ పుణ్య దంపతులు విశ్వవిఖ్యాత నట సార్వభౌమ నటరత్న తెలుగుదేశం పార్టీ వ్యవస్థాపకులు డాక్టర్ పద్మశ్రీ నందమూరి తారక రామారావు గారు, అలాగే మా తల్లి గారైన శ్రీమతి నందమూరి బసవతారకం గారికి వాళ్ళ పుణ్య దంపతుల బిడ్డగా జన్మించి మరి ఆయన ముఖ్యంగా నటనలో ఆయన ప్రతిరూపంగా మీ అందరి గుండెల్లో నింపిన యుగ పురుషుడు, అలాగే విశ్వ నట రూపం ఎలా ఉంటుందో చూపించిన కారణ జన్ముడు, నా తండ్రి గురువు దైవం ఆయన మా తండ్రి గారికి నా గాయత్ర పరమంత్రం నమాతు పరదేవత నా హరే పరతస్త్రాత నా అనృత పాతకం పరం అంటాము తల్లిని ఉద్దేశించి. అలాగే తండ్రిని యస్మాత్ భారతవిద్య ప్రాదుర్భుతన భక్తి గురుణ సంతుల మాంసీ శాస్త్రం తస్మై సర్వజ్ఞ మూర్తి పిత్రే అంటాం. వాగర్త సంపర్తో వాగర్త పతి ఆయనకి వాసుడుగా అయితేనేమి, లేకపోతే అటు హిందూపూర్ ఒక శాసనసభ్యుడిగానైతేనేమి, ఇలా ఎన్ని అవకాశాలు నాకు దక్కడం అనేది అది ఆ తల్లిదండ్రులు వాళ్ళ యొక్క బిడ్డగా పుట్టినందుకు నా పూర్వజన్మ సుకృతంగా భావిస్తూ మరి నాడు ఈ వేదికను అలంకరించిన వాటి ముఖ్య అతిథిగా అయిన శ్రీనాథ్ రెడ్డి గారు, దట్ ఈస్ పబ్లిక్ హెల్త్ ఫౌండేషన్ ఆఫ్ ఇండియా ప్రొఫెసర్, డిస్టింగ్విష్డ్ ప్రొఫెసర్ అయిన, అలాగే మా రీసెర్చ్ అండ్ డెవలప్మెంట్ ప్రెసిడెంట్ సిహెచ్ మోహన్ రావు గారికి, అలాగే బసవతారకం ఇండో-అమెరికన్ క్యాన్సర్ హాస్పిటల్ రీసెర్చ్ ఇన్స్టిట్యూట్, ఇటు ఆసుపత్రి, అటు రీసెర్చ్ IACRF మన రీసెర్చ్ అండ్ డెవలప్మెంట్ బోర్డు మెంబర్ మా సహచరులు డాక్టర్ JSR ప్రసాద్ గారికి, అలాగే డాక్టర్ రాఘవేంద్ర ప్రసాద్ గారికి, అలాగే మన డాక్టర్ HOD సర్జికల్ ఆంకాలజీ అండ్ మెడికల్ సూపరింటెండెంట్, మెడికల్ డైరెక్టర్ డాక్టర్ సుబ్రహ్మణ్యేశ్వరరావు గారికి, అలాగే మన HOD మెడికల్ ఆంకాలజీ చంద్ర రాజప్ప గారికి, ఈజ్ ఆల్సో ఇన్ ద బోర్డ్ ఆఫ్ IACRF, అండ్ రఘునందన్ రావు గారు ఉన్నారు ఇక్కడ, అలాగే శశికిరణ్ గారు అందరూ, అండ్ డాక్టర్ GN రావు గారు, అందరు డిస్టింగ్విష్డ్ సైంటిస్ట్, వాళ్ళందరూ కూడా ఈ సభాముఖంగా ముందున్న డాక్టర్లు అందరికీ, మిగతా ఇక్కడికి వచ్చారు, అక్కడ IACRF సైంటిస్ట్ ఉన్నారు, అలాగే ఇంటర్న్స్ ఉన్నారు ఇక్కడ, క్లినికల్ ట్రయల్స్ చేయడానికి వచ్చిన వాళ్ళందరూ కూడా నా ఆహ్వానం పలుకుతూ, ముఖ్యంగా ఈ యొక్క ఉగాది అంటేనే ఒక ఉత్సాహంతో, ఉగాది అంటే ఒక ఉత్సాహంతో ఒక పరుగు, అది ఉగాది అంటే ఒక ఉప్పుగల ఉత్సాహంతో ఒక కవిత్వం, అది ఉగాది అంటేనే ఒక కొత్త సంవత్సరానికి ఆహ్వాన గీతం. అలాగే ఉగాది అంటే మన నాలుగు మీద పంచరుచులు నాట్యమాడే పండగ. అలాగే ఉగాది అంటే కళల కోలాటంలో కవితల ఉబలాటం ఉగాది అంటే. అలాగే ఉగాది అంటే ఒక ఆత్మీయ అక్షరాల ఒక అనుబంధం ఉగాది. అలాగే ఉగాది అంటే ఒక పచ్చని కొమ్మ పైన ఒక కోయిల గానం ఉగాది. అలాగే ఉగాది అంటే మదిలో ఒక హర్షధ్వానం ఉగాది అంటే. అటువంటి ఈ ఉగాదికి all of you today as we gather here to mark a day, mark a truly momentous occasion. This is Basavatarakam Indo-American Cancer Hospital and Research Institute, the inauguration of our State of the Art Research and Development Center. I would first like to extend my deepest gratitude to our Chief Guest, Professor Srinath Reddy, Honorary Distinguished Professor in Public Health, and who has dedicated his life to the betterment of communities and the creation of resilient healthcare systems. His vision and leadership serve as an inspiration to us all, and we are truly honored to have him with us today. Your presence, Professor Srinath Reddy, greatly enriches this occasion and motivates us to redouble our efforts in serving society. The milestone is especially significant as it aligns with our Silver Jubilee Year, marking 25 years of compassionate service and a steadfast commitment to fighting cancer. What began as a 110-bed hospital envisioned by my father in memory of my mother has grown into a 650-bed institution offering world-class cancer center. Their vision was simple yet profound, to ensure no patient would be denied treatment because of financial constraints. Over the years, Basavatarakam Indo-American Cancer Hospital has become a beacon of hope for countless families, providing cutting-edge treatments and compassionate care. The inauguration of this research and development center represents our next big step, an initiative that embodies our mission to innovate, advance, and make cancer care more affordable and accessible. Research is a key to winning the battle against cancer. Through this sector, we aim to explore new frontiers, develop cost-effective treatments, and make groundbreaking discoveries that will save lives and bring hopes to millions. For a country like India, where cancer cases are on the rise and access to affordable treatment remains a challenge for many, research serves as the cornerstone for improving health care equity. Investing in research empowers us to develop solutions tailored to the unique needs of our population, reduce dependency on imported treatments, and address regional disparities in care. It's not just a scientific endeavor, it is a moral commitment to our people. Cancer is an evolving disease, and the solution to its challenges lies in continuous research, innovation, and global collaboration. Sorry. I would also like to take this opportunity to express sincere gratitude to Dr. Raghavendra S. Prasad Garu and Srimati Kalyani Prasad Garu for the exemplary contribution of 10 crores towards this effort. In their honor, we have named this facility as Srimati Sadhanakunda Kalyani Prasad Basavatarakam Indo-American Cancer Research Center. The generosity reflects a spirit of philanthropy that has always been the cornerstone of our progress. Sir, I would like to extend my warmest congratulations and best wishes to the IACR board members, scientists, and their dedicated team. Under the experienced leadership of President Dr. C.H. Mohan Rao Garu, I am confident that this exceptional team will achieve great things and set new benchmarks of excellence. Their expertise, vision, and unwavering commitment inspires us all, and I believe they will make remarkable contributions here. Congratulations and all the very best for the journey ahead. Before I conclude, I would like to extend my sincere appreciation to everyone who made this remarkable facility possible in such a short time. The dedication and tireless efforts of our teams, ranging from maintenance and engineering to hospitality, IT, and beyond, have been nothing short of exceptional. This state-of-the-art center is a testament to our collective commitment, teamwork, and the spirit of service that defines our institution. I would also like to acknowledge the guidance and leadership of our CEO, Dr. K. Krishna Garu, experience and for being a guiding light in the field of public health. To all our supporters, well-wishers, and staff, thank you for being part of this journey. Let us continue to uphold the values of compassion, excellence, and commitment that define Basavatarakam Indo-American Cancer Hospital and Research Institute. Together, we can create a future where cancer is no longer a cause for fear, but a challenge we conquer with resilience and hope. Thank you, and Jai Hind.
Thank you, sir. It is an immense honor to welcome our chief guest, Professor K. Srinath Reddy Garu. He is a towering figure in the field of public health. As a renowned cardiologist and epidemiologist, he has dedicated his life to advancing public health systems. His career includes serving as the head of cardiology at All India Institute of Medical Sciences, and he is a late physician of our Shri Manmohan Singh Garu, and he holds the prestigious academic positions such as he visited first time in Harvard University. He has been a trusted advisor to several state governments. He has authored over 570 scientific publications and several books, including the acclaimed Make Health in India and Pulse to Planet. Please put your hands together. His work has earned him numerous accolades, including Padma Bhushan and WHO Director General's Award and the Luther Terry Medal for Outstanding Contributions to Global Tobacco Control. Sir, your presence today inspires us to strive harder in our mission for advancing cancer care and build healthier communities. We are privileged to welcome you today. I request all our dignitaries on the dais to felicitate our chief guest, Professor K. Srinath Reddy Garu. We are privileged to have Professor Srinath Reddy Garu to share his thoughts and vision. Please welcome our esteemed chief guest.
వేదికకు వెలుగు తెచ్చిన పెద్దలకు, ఈ సభకు శోభ సమకూర్చిన ప్రముఖులకు, నమస్కారం. అర్ధ శతాబ్దం నుంచి ఢిల్లీలో స్థిరపడిన ఈనాడు తెలుగు గడ్డపై నిలబడ్డ తెలుగు బిడ్డగా తొలి పలుకులు తెలుగులోనే మాట్లాడాలనుకుంటున్నాను. సభాధ్యక్షుడు వారు అనుమతిస్తే తదుపరి ప్రసంగం ఆంగ్లంలోనే గావిస్తారు. Indeed, it's very timely that this particular institution has emerged to stimulate research in cancer in India. Cancer rates are rising all across the world in men and women, and indeed across all ages. And therefore, we do need to pay attention to this particular problem. The cancer is rising both in terms of incidence, which means the new cases detected, as well as in cancer-related death rates. But whatever are currently estimated are clearly underestimates, because many cases of cancer are not detected, and also the treatment is not easily available, and many die without their deaths being properly recorded as cancer related. So what we are really seeing is a much larger problem than what has been documented. A recent international study of more than 200,000 persons in 27 countries reported that in high income countries, cancer has already overtaken cardiovascular disease as the leading cause of adult mortality. As a cardiologist, I used to always say cardiovascular disease is the leading cause of death, and it does remain globally overall statistics. But in high income countries, it is already overtaken, and in low and middle income countries, it is rapidly on the way to overtaking and becoming the number one cause of death. And therefore, this is something that we'll have to anticipate and prepare for. Indeed, if you look at why cancer is rising so rapidly and why But cardiovascular disease not only adopted public health approaches to control and prevent cardiovascular disease or even delay the onset of disease, but also managed to develop very effective therapeutic interventions which could be provided in a easily available and affordable manner across the world. And that's why cardiovascular mortality rates have started declining in high-income countries, and now they are declining also in some other low and middle-income countries. So the lesson is that we really have to develop very effective interventions both in public health as well as in clinical medicine, but we have to make them available to the largest number of people who require it. And that is where this particular institution has been very remarkable in its clinical contributions and now can show the way even through its research contributions. In terms of cancer incidence, we know that the risk factors are fairly common: age, tobacco, alcohol, unhealthy diets, decreased physical activity, exposure to environmental pollutions and toxins. All of these are known, but we do need effective interventions in the public health space to prevent many people from acquiring the risk and ensuring that those who do acquire the risk do not develop cancer, and those who develop cancer are detected early and are treated effectively. In India, a recent ICMR study revealed that about 12.8% increase in incidence of cancer cases would occur between 2020 and 2025. We just entered 2025. But we know that these are rising, and in 2022, India had 14.1 lakh new cancer cases and 9.1 lakh deaths due to cancer. Now, many of these could have been avoided if we had effective interventions. And these are, as I said, likely underestimates. Now, I would like to give a little anecdote about what happened in Tamil Nadu about 20-25 years ago. The government of Tamil Nadu had a World Bank funded project for health systems development, mainly focused on maternal and child health and infectious diseases. The government of Tamil Nadu then said, we are getting a lot of reports about rising cancer incidence as well as high levels of hypertension and cardiovascular disease, even from our villages. We would like in the next phase of the World Bank project to have interventions against cancer as well as cardiovascular disease. The World Bank said, no, we don't think this is very true, because low and middle income countries do not have that much of a burden. This is mainly a high income country problem or a problem of rich people in high income, in low and middle income countries. Took a tough stand and said, we don't want your money for the next phase unless you listen to us. And finally, they agreed to launch programs on hypertension control and cervical cancer. Well, the interventions, which were mainly community-based, primary care-based, and also linked to advanced care when needed, were analyzed a few years later. It was found that hypertension control was extremely cost-effective, not only in terms of detection, but in terms of treatment. But cervical cancer was declared not cost-effective because the cases were detected, they were not referred adequately, and the treatment and higher levels of care was not available, and therefore ultimately even the detected cases could not get the care required, so it was declared cost ineffective. Fortunately now we are in a different space. Our medical and healthcare systems are developing much faster, and we are able to link up our primary, secondary and tertiary care systems much more effectively. But this chain of continuity has to be maintained if we really have to ensure that cancer is detected very early in primary care, and when necessary and when required has to be sent up to higher levels of care without unnecessary delays. So this becomes a very important element as well. Now, in terms of medical advances in cancer, there have been very many, and that's where the research comes in. I mean, as has rightly been pointed out, if we ask the right questions, the answers are always out there, and we are able to discover the answers.
But it's very important for us to ensure that we keep abreast of what's happening elsewhere in the world, not only replicate it, but to ensure that we have developed our own methods of providing solutions to various problems which are much more relevant to our context. And the medical advances in cancer are really remarkable. In terms of diagnostics, we are seeing advances in organ imaging, tissue histology and pathology, integration of clinical data with new molecular data, such as germline genomics, epigenomics, pharmacogenomics, circulating tumor DNA, and these have all greatly increased the diagnostic precision and personalized approaches to treatment. And artificial intelligence is now bringing in even greater strength, is providing great support to these diagnostic capabilities. Even in terms of therapy, we are seeing huge advances. Novel treatments have emerged, targeted therapies, monoclonal antibodies, CAR T-cell therapies, immune checkpoint inhibitors, and the 5 pillars of cancer treatment, which are surgery, radiotherapy, chemotherapy, targeted drug therapies, and immunotherapy, are all advancing. Even in surgery, we are seeing robotic-assisted laparoscopic surgery. And in terms of care, in terms of health systems, we are also seeing much greater emphasis emerging on integrated multidisciplinary care. We know that we just cannot manage it through only one discipline. Many disciplines will have to be involved if we have to deliver competent and compassionate care. And that becomes an important element as well. So health systems research also must proceed. So research must look at basic sciences, clinical sciences, and what I would call health systems and public health sciences, if we are really to control cancer in the right manner. But the reasons for poor cancer control are late detection, lack of capability in primary care in particular, for early detection and diagnostic evaluation, delayed referrals, and also limited availability of well-trained personnel. Well-equipped facilities are few, particularly in some of the states in India, though some states are better endowed, and high costs of tests and treatment. And particularly in surgery, radiotherapy, and palliative care, there are considerable shortages in many areas of the country. We have to ensure that these inadequate facilities are addressed. At the same time, we also need to address how best we can increase public awareness, not only for prevention, but for early detection through self-evaluation, through self-referral, because self-referral does not happen in timely fashion, and if they come at a late stage, then we will have problems. And if primary care does not pick them up early, we'll have several missed opportunities, and we must reduce those missed opportunities in primary care. And these become very important, and though I'm the former president of the Public Health Foundation of India, I can offer on behalf of the organization our full support for not only ensuring that community-based programs are better advanced in terms of community education, but also primary care physician training. I can say with some pride that about nearly 48,000 primary care physicians have been trained in different chronic disease management across the country through programs which have won every single top-level award in skill building, including the Quality Council of India Platinum Award. So we have the capability. We'd like to offer our support to you in ensuring that cancer is not only restricted to tertiary care institutions, which are of course required, but right from primary care we build up the chain in which from the community-based recognition and response to primary care pickup to tertiary care, we've established a chain, and that's where we can actually partner very effectively together. So, what we need also are pluralistic approaches. Modern medicine must combine hands with traditional systems of medicine. That is one advantage we have in India. We do have several traditional systems of medicine, and the kind of antipathy that existed between these different systems of medicine is now fast fading. It doesn't mean that we abandon our scientific approach and unquestioningly pick up any practice, but we can and should subject all possible avenues of therapy and supportive care, including palliative care, to a scientific examination, and wherever possible, we should be able to bring in complementary systems of medical treatment. Then, digital health is now becoming very important, and digital health has become an extraordinary tool for ensuring very greater access and affordability. Telepathology, teledermatology, all of these have become very important now, and therefore we can actually use them very effectively for cancer diagnostics. But what about making sure that cancer care becomes affordable? As was said, cancer bankrupts the families. But there are also reasons why we should innovate and develop less expensive medicines. An example of HIV/AIDS was brought in. Actually, it was Cipla which really brought in all the antiretroviral medicines into South Africa the first time. It changed the world and gave a fillip to generic medicines. There's no reason why our industry cannot develop that as well. But more importantly, there are other innovations even now. For example, if you look at the study that has been done by the National Cancer Grid, steered by the Tata Memorial Hospital, they brought in 250 cancer centers in India together for pooled procurement. They negotiated with the pharmaceutical companies on behalf of the 250 cancer centers across India. And for 40 cancer drugs, they managed to get a very fair price, to the extent that there was an 82% cost reduction in 40 cancer drugs, with a range extending from 23 to 99%. Now, to get 82% cost reduction in 40 cancer drugs only through the strength of pool procurement, that means there is a single purchaser and multiple providers, you can set the terms. So there are very many methods in which we can actually reduce the cost of cancer care, and we should explore all of those possibilities. And the total saving by this method, they said, was 13.2 billion rupees. Now, why emphasis on research in India and innovation? It's already been pointed out that we can find answers for the world, and certainly we can. Why? Because India has the highest, not only has the highest population now, it has the highest diversity of gene-environmental interactions. You have a large, diverse genetic pool. You have different nutritional patterns. You have different social conditions. You have different geographies and different health systems. You can actually diversity that you will not be able to, you will be able to generate evidence which the West will not be able to do. They have been dealing with very limited populations, and they have been prescribing their algorithms to the world. It's time that we find algorithms which are better suited to our context. And then we can also enrich global science by extending our scientific knowledge of this multitude of gene and environmental interactions, and seeing how cancer is occurring because of different interactions, and how cancer can be modified or treated. So, as a service to our own country and as a service to global science, I think this particular institution can play a tremendous role. So, I would say that basically it's very important for us to ensure that all the possible links are explored in terms of institutional partnerships, institute of multidisciplinarity, and in terms of ensuring that within the health system, linkages are there between primary to tertiary care all through. You mentioned Dr. G. N. Rao Garu is a member of the advisory committee. N.V. Prasad has this beautiful construct of vision centers and primary care, linked to secondary care, linked to tertiary care hospitals. We should look at how cancer can be actually not only treated in the best possible manner at the tertiary care institute, but how right from primary care you establish services for early detection and early referral, and how that whole chain can be established very effectively. So I'm sure with your energy and with the vision that of Shri Nandamuri Garu, that kind of a Vishwarupam will be seen in the evolution of this institute. Thank you.
Thank you, sir. To honor our chief guest dedications and achievements, I now invite all dignitaries on the dais to felicitate our chief guest, Professor Srinath Reddy garu. I now invite Dr. Rajat Garu to deliver the vote of thanks.
Good evening, everyone. On behalf of entire team of Indo-American Cancer Research Foundation and Srimati Sudaragunda Kalyani Prasad Basavatarakam Indo-American Cancer Research Center, I extend my heartfelt gratitude to all of you for being part of this momentous occasion as we inaugurate this new chapter in our commitment to advancing cancer care. First and foremost, I would like to express our deepest appreciation to our esteemed Chief Guest, Dr. K. Srinath Reddy for gracing us with your presence today. Your distinguished leadership and unwavering support in the field of medicine and public health research are truly inspiring, and we are honored to have you as part of this significant milestone. Thank you. I also want to extend a special thank you to Shri Nandamuri Balakrishna Garu, Chairman and Managing Trustee of our hospital. Your visionary leadership and constant dedication to providing world-class healthcare have made this R&D center a reality. We are immensely grateful for your continued support and guidance, sir. Thank you. A heartfelt thank you to Dr. C.H. Mohan sir, for your invaluable contribution both as trustee as a driving force behind the ISCRF initiatives. Your passion and commitment to improving cancer treatment have been crucial in shaping the direction of this center. I would also like to acknowledge the presence of our esteemed trustees, Sri J.S. Prasad Garu, and we have not here Sri Bharat sir, Srimati Narabramani madam, and Dr. G. Reddy, and Dr. Datrayathu Nori sir, and Dr. P. Raghav sir. Their dedication to the mission of this hospital has always been unwavering, and we are privileged to have your leadership and support as we take this next step forward in cancer research. A special mention to the trustees of ISCRF Center, including Dr. C.H. Mohan sir, Sri J.S. Prasad sir, and Dr. G.N. Rao, and Dr. B. Shashikiran sir, Dr. D. Raghunath Rao sir, and Dr. Datrayathu Nori sir, Dr. Ragendra S. Prasad. Thank you so much, sir, for your support to this organization. Because of you gave us fuel to go forward. Thank you so much. And I look forward to collaborating with each one of you and we chart the future of cancer treatment. I would also like to extend my gratitude and heartfelt thank you to our CEO and Secretary of ISCRF, Dr. Krishna sir, whose vision and strategic leadership have been instrumental in making this R&D center a part of our hospital future. Sir, without you, this was not at all possible. Thank you so much, sir. And your guidance and motivation will continue to inspire and direct us as we embark on this journey of discovery and innovation. Finally, I would like to thank CFO sir, CEOs, our entire project team, staff, researchers, doctors, students and collaborators and partners who have worked tirelessly to bring this project to life. Your dedication, passion and hard work have created a foundation that will not only advance cancer treatment but also bring hope to countless patients and their families. As we inaugurate this new facility, we are not just opening a physical space but creating a beacon of hope for the future of cancer care. We are committed to driving forward groundbreaking research that will shape the future of oncology, and we do so with knowledge that we have the support of each and every one of you who are assembled today. Thank you once again for being here to celebrate this significant moment with us. We look forward to collaborating with all of you and making a difference in the lives of cancer patients worldwide. Thank you so much.
Shri Nandamuri. Thank you all dignitaries, guests, attendees and media people for cooperating with us and making this event grand success. Have a wonderful evening.